Assalamu alaikum, everyone. We're going to start with our Sunday program, inshallah. So please have a seat. And we have a very distinguished guest speaker for our ICSC Sunday program, Dr. Ilham Al-Sarraf-Rope, who will be presenting on mental health awareness. Dr. Ilham Al-Sarraf-Rope was born in Iraq, but lived in the United States most of her adult life. She received her doctorate in clinical psychology and obtained her license in marriage, family, and child therapy. She is currently working on her private practice at Kaiser Permanente Mental Health in the Los Angeles area and is recently retired. She served as a commissioner on the Board of Behavioral Sciences examiners for the MFCC candidate to be licensed. She worked as an assistant head immigration officer at the Canadian Embassy. Dr. Ilham was awarded a lifetime teaching credential as adjunct professor of psychology at Phillips Academy and Glendale College. She held a position as a school psychologist for 3 New Horizons school campuses. She conducted research on the impact of social inhibition in Arab culture on the development of mother-child attachment. Dr. Ilham published many papers and articles in various journals and newsletters. She devoted her life to the humanitarian causes on national and international arenas on issues like post-traumatic stress, conflict resolution, as well as a mediator in employer-employee disputes. She conducted multi-dimensional groups, depression, anxiety, stress management, women, grief, boundaries, and couple therapy. Dr. Ilham presented on the following topics: trauma disorder, the effect of stress on physical and psychological levels, post-traumatic stress disorder, and anxiety and depression disorder. Dr. Ilham participated in delegations, lecturing, training, and volunteering. She is affiliated with many organizations that allowed her to work on many humanitarian projects around the world, such as People to People Ambassadors, Russia and Australia, lecturing on the plight of the Iraqi citizens dealing with the tragic effects of the sanctions. South Africa, participating in the Truth and Reconciliation Symposium, working with victims of apartheid. With Doctors for Social Responsibilities to Iraq during the sanctions, joining the Pencils for Peace initiative and delivering much needed medicine. Dr. Ilham worked with the United Nations Relief Committee to address the effects of the sanctions of the Iraqi people. She volunteered at the Red Cross aviation disasters, Hurricane Katrina victims, and debriefed airline staff and passengers during the 9/11 disaster. She assisted in the Alaska Airlines crash forensic debriefing and also volunteered at Common Bond Institute USA, Harmony Institute of Russia, IMC International Medical Committee, AAMA Arab American Medical Association, IMSA Iraqi Medical Sciences Association, and Humanities Psychology Association. Dr. Ilham appeared on the Oprah Show, Good Morning America, and on many media broadcasts, sharing her passion around the world to enlighten others about the humanitarian plight and the suffering nationally and internationally. So please give a warm welcome to Dr. Ilham Al-Sarraf-Rope.
For everybody was back here, that's why they have something for the kids. That's why everybody's here.
That's fine. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm very pleased to be here representing the month of May, which is the mental health awareness. And I thank Sister Erica for this beautiful long introduction. Much appreciation. This topic, the mental health awareness, is close to my heart. It is something that I've been advocating for the last 30 years, that to become aware of what is mental health and to verify, because there's a lot of stigma, a lot of myths about it, a lot of misunderstanding. So when Sister Erica asked me to come and present this to this Islamic Center, which I appreciate very much, I could not say no, even though I was not feeling up to it. I had to do some research in order for me to present it today. So thank you very much for the invite and for giving me a platform to be able to express what is mental health and what are the myths, what are the facts, what are the statistics of mental ill people. So I will be talking about that. I will also talk about how the body, the brain, and the mind connect with one another in order for us to be able to stay in a survival mode. Without that connection and interaction, subhanahu wa ta'ala made it possible for us to integrate those three elements in our body. If there is time, I will talk about what is stress and how it affects the body, how it affects the mind, and how it affects our mental well-being as well as physical well-being. I will also, hopefully, if there is time, I'll give you tools and resources where to reach resources in case one needed. So let me, and intervention, obviously, intervention tools if the time is permitted. So Sister Erica will help me navigate this beautiful computer. All I have to do is to touch the next slide. Oh, you can't hear me? Okay, can you hear me now?
Yeah.
Okay, beautiful. Okay, so what I want to do is to ask the audience question that reflect your understanding. What is to you, what mental illness mean to you? There are a lot of preconceived understanding or misunderstanding about mental health. So when I do give my diagnosis with mental illness, what is the first thing that comes to your mind? What are the pictures that comes in your vision when you're thinking of a person who is mentally ill? What are the feeling and the reaction that comes up as well? How is it different that if I were to give you a physical diagnosis, such as pre-diabetic or ulcer, or maybe even digestive problem? What pictures comes up for you? What thoughts comes up for you? Now, would this picture comes up for you when I say mentally ill, diagnosis, deranged people? You will notice people are silent, some of them on the floor, some of them even evil looking in that picture. That's how we perceive mental illness picture. Or you can go to the next one. And there's a standard jokes. I think most of us have heard it, so I'm just going to read it. It said, a person who needed help recognized a resource and called a community clinic. Hello, this is a hotline, by the way, a hotline answering service. So the standard response to that, if you are obsessive compulsive, press 1 repeatedly. If you are codependent, have somebody press 2 for you. If you are codependent, if you have multiple personality, press 3, 4, 5, and 6. If you are paranoid, we already know which one you want. So these are standard jokes that people associate either with this picture or with the humor because of our own misunderstanding. You don't need to answer what picture came up for you or what humor jokes came up for you when I said you have a diagnosis of mental illness. So now we'll go to where did this stigma, where did this misconception came about? The diagnosis of mental illness has an extraordinary, long and tumultuous history. The treatments constitute a range from being beaten punished, electrocuted, locked up in an asylums, put in a straitjacket. Even this standard, it's still here with us. Some people avoid people who does have, if they say, I have mental illness, you know, people is like, oh, I don't know what that is. Maybe that picture comes up for you. Until the recent century, believe it or not, we are now in this century, we have a better understanding of what mental illness means. The criteria by which they diagnosed mental illness was, listen to this, any deviation from societal normal behaviors considered mentally ill and abnormal. That's how they used to diagnose the mentally ill people. Let's go next and see further history. Mental illness was historically associated with demonic possession and evil spirits. Most of the century, as far back as prior to Roman and Greek Empire. So, older methods of curing mental illness included near-death experiences. These range from theorizing that madness can be cured by drowning. We literally visited in Iowa an asylum that is still that bathtub that they fill with cold water and ice, and they kind of drown them in there to knock off the devil out of their body. So also some, I don't know if any of you seen the movie. I refuse to see it because it's very scary, The Exorcism. And that the priest, it became the priest who will be beating the heck out of the devil and getting it out of your mind. Electric shock it's still being done today, but a little bit merciful. Why it's merciful? Because they learned that when they give them that electric shock, their whole bone, a lot of their bones start breaking. Okay, so now they give them sedative before they give them the electrical shock. Sometimes they have loss of recent memories, but we're finding out that they do restore it afterward. Housing them in asylum and isolation. Many asylums had very limited success. So even though people that have family members with them, they put them in the asylum because they don't know what to do with them. They beat them, they gave them electric shock, nothing has worked. So what happened, they just kind of assigned them in the asylum to give responsibility to somebody. They're hoping that it will help them. But what happened, the asylum became overcrowded. And you know, a lot of research, when people are stressed and put in a small place, even the normal one, whatever we call normal, they become very, very stressed. So lunatic, it's called lunatic asylum, by the way. It's gone out of fashion right now. Very few people want to go there. But many were open all the way, maybe to few decades ago, as recent as that. That's where our misunderstanding takes place here. So, okay, help you. Oops. Okay, I messed it up. Sorry. Technology, I am totally challenged here. And so Erica's going to help me here. Thank you. Go to the next. Can you put it up? Thank you. That's beautiful. So just put it up like that. Beautiful. Okay. So interestingly enough, I was able to find Madness and Civilization article that, guess who wrote it? Professor Skull. It's not appropriate kind of thing. This is a popular view in ancient cultures, was madness was the cause of evil spirits. So in the Bible and the Old Testament or the Jewish Torah, evil spirits and divine punishment were considered causes of mental disorder. Do you see how far back we're going all the way to the Old Testament? It is true, even in the Islamic culture. I'm going to underscore the word society. It's not in the Quran. It's not in the teaching of the Hadith. But our culture, Islamic culture, embraced as well the evil, demonic possession. And also the Chinese society also embraced it. Those believe in possession and spirit and some kind of punishment are widespread practice. So I need you to distinguish between culture and religion, please. The ancient culture, the ancient Greek and Roman kind of stepped up away from the demonic, and they associated more closely with physical sickness. So they're the first culture that put the physical and mental together and began to do research. What did they do? They explained that there are 4 hormones that is called blood, the bile, yellow bile, and the phlegm. These are, if they are imbalanced, some mental difficulties processing in the brain is happening. And I remember at, maybe in the 50, early 60, I remember some of the women, they go not to the doctors, it's kind of associated doctor like a PA, and they will actually cut in the back, on their back near their neck to relieve some blood. And they said with relieving, I don't know if any of you old enough to remember the 50s and the 60s, but in Iraq, it was practiced. Some of the people I used to know, friend of my mom, they would go and release some of the blood to balance the hormones in there based on a Greek and Roman finding, which is a little bit closer. I'm sorry?
It's still until today.
Until today. Oh, wow. So, sorry? Yeah, al-hijaba, yeah. Well, I mean, in their mind it is, but it does not do anything to the brain, because it's based on research of when is the Roman culture came, the Roman and Greek culture, how many centuries ago? A long time ago. That's as close as we can get. Okay. So they explained that relative balance of those things affect the temperament and affect also the character. So when we're talking about temperament, we're talking about emotions, right? We're talking also about character of that person. How do they talk? How do they communicate? How are they there, So this is what was the basis for our research as of today. The Arab world incorporated and embellished even further about the humors. So they still think that black bile, blood, yellow bile, but since then research had advanced and exploded there. So the Arab were also advancing the knowledge of the Greek and the Roman. Okay, so let me share with you this cute joke. I thought, oh, it's funny. So one day, an old man and his wife visited a doctor for a checkup, yearly checkup. The doctor wanted to examine the man first. After examining the old man, he said, you know what? It's surprising you are in an excellent health. The patient said, well, I attribute that to my good and clean life. The doctor said, your good and clean life? What does that mean? Yes, I have lived such a good and clean life. The Lord himself turns the light on for me when I go to the bathroom and turn it off when I leave. The Lord himself come down and does that for you? Yes, insisted the old man. The doctor nodded politely and asked, I'm going to examine your wife right now. The old man left the room. The doctor came and examined his wife and he said, again, you guys live a very healthy and excellent health. How is my husband? Said the wife. Physically, he is fine, but I'm worried about his mental health. Why, doctor? Well, he insists that the Lord himself turn the lights on for him and when he uses the bathroom and turn it off when he leaves. The wife said, "Oh my God, the damn fool is peeing in the fridge again." Okay, let's go to mental health and the illness awareness. This is what I'm here for. And the computer so far is agreeing with me. So statistic, and I really want you to pay attention to the prevalence of mentally ill people around you and maybe even living with you. 1 in 5 US adults experience mental illness. Only half of them receive treatment. 1 in 20 experience serious mental health illness, but only half of them receive treatment. That's how much we have shortages. 50% of lifetime mental illness begin at age 14, and 75 begin at age 24. The average delay between diagnosis of mental illness and receiving treatment, research shows there's 11 years between them being diagnosed mentally ill, and getting treatment. 122 million people live in mental health pandemic. 122 million live in a shortage of mental illness clinics. They cannot receive any treatment over there. I'm talking about in US. I'm not talking about developing country. I'm talking here, 122 million people. 1 in 5 young people during the COVID time experience the impact of mental illness. We see the rise continued because the quarantine, because of the isolation, because of information. Yes, get vaccine. No, don't get vaccine. This is poisonous to you. Yes, get vaccinated. So the unpredictability, people, if you are living in unpredictable, uncertain circumstances, you're going to have a mental illness problem because there isn't anybody that can give you assurance. Yes, do your vaccination, put your mask on, stay away, isolate, quarantine, COVID will not touch you. That was not true. In my case, I had it 4 times and I used all those methods. We have increase of suicide of teen and young 20s was so high that it was unbelievable because of we isolated them and we put them in homes that were not adequate to provide some activities for them. So I'm going to skip that one because I touched on it. Whoops. Okay.
So is the vaccine good or?
To this day, there were a lot of doctors said that was poison to your body and therefore you shouldn't have had it. The other side of the doctor said, no, get it. For sure it will affect. But still to this day.
I had colds, then I got sick. I got sick most of the time. Before I was very healthy. I didn't have any issues, but I had to travel at that time. So they didn't allow me to travel without doing vaccine.
Exactly.
So I had, but most of my friends, they didn't do it. My doctor, they never done it. All the doctors.
Yeah. Yeah. So that doubt causes stress on the body. Should we or shouldn't we? The professional, the politician, the leaders did not have any ideas. Yes.
I didn't get any vaccine, but I get the COVID once,
Uh-huh.
but it was not strong. It
Uh-huh.
was just regular. I went to the doctor and they say, you're lucky you get it in the chest.
Yeah,
I couldn't eat, I couldn't smell, that's all.
exactly.
2 weeks it took me and it's gone.
Exactly. Yeah. So Alhamdulillah, that is wonderful because, you know, I got it and I ended up in ICU and I had the 3 vaccination. So who's to tell? They don't know. And to this day, they still don't know. Like this young lady asked me, I honestly don't know. I wish I could tell you, yeah, go ahead, get the vaccine.
No,
Other-
I have that.
No, what I'm saying is to this day, we don't really have a straight answer from the professionals. So,
That's that most people will have done the COVID test that will help you and good. Most of the people that are not even doing the vaccine, they're very,
yeah.
right, sounds getting sick, something, start taking the vaccine.
Yeah. So, I mean, once again, you're doing your own research. Some of my friends took it and some didn't, and some got it, some didn't. Do you see what I'm trying to say, underscore, is when we live in an uncertainty, unpredictability, we don't have a proper guidance. This causes stress on us, because we have to take the responsibilities ourselves to do the research. And we don't know if, anybody could put anything on Google. I can put said, don't take the vaccine because I got sick and I ended up in ICU, right? And I'm a doctor, supposedly. I know what I'm talking about, but I really don't. So let's get back to the slide. Thank you for participating. That's really good. Mental ill health myths are prevalent. Thus, facts are very important to get rid of these myths and to have a better understanding. That is my passion. That's where I really want to kind of underscore it. Mental health is an essential aspect of our overall well-being. But despite its significance, despite the statistic that I read to you, still there is surrounded by a lot of misconception. These myths can lead to stigma. Stigma lead to discriminations and even prevent people from seeking help when they do need it. If you are mentally ill, it's like, oh yeah, okay, thank you, we'll talk to you later. People and that stops people from telling you they are mentally ill because of the stigma. I am hoping to introduce facts to challenge the most common negative myths surrounding the mental health and well-being. Thank you, Verica. Let's go here. There we go. So let's start with, whoops, I think I skipped one. There we go. Myth number 1, children don't experience mental health issues. Children, in fact, can indeed experience mental health challenges ever since age 2. I literally was with a 2-year-old child, a young little baby boy, and he had some difficulties with anxiety. He was not able to latch onto his mom, okay? And we had to diagnose him. We had to find out what is the underlying cause for that. Myth 2, people with mental health conditions are violent. The fact is, that's a big misconception. Most individuals with mental health conditions are not violent. Most, okay? Myth 3, people with mental health needs cannot tolerate the stress of holding down jobs. I'm here to tell you the fact that 75 to 80% of people that I worked with, because they said, as soon as they hear I'm a psychologist, oh, you're half crazy. Right away, or psychiatrist or anybody, oh yeah, you half crazy. And I have a line for them after being hurt and, oh, I'm not really crazy, but I love people, I love behavior. I found a line that really helped me to say, well, if I am crazy, at least I know I am. Do you? That kind of stopped them. Anyways, that's kind of cruel, but anyway, I just needed to help myself over here. Sorry about that, guys. Okay, so they do hold a job. Myth number 5, there is no hope for people with mental health issues. The fact is, recovery is possible. I've been practicing for over 30, 35 years and don't stop counting the years. I don't want anybody to know how old I am. Anyway, recovery is possible and many individuals do recover from mental health conditions. Myth number 6, therapy and self-help are waste of time. Just take a pill, you will feel better. The fact is, both therapy and self-help approaches are valuable for mental health, very valuable. Myth number 7, I cannot do anything for a person with mental health issues. Fact is, the support with mental health is number one, matters a lot. To have anxiety or to have depression or to have any of diagnosis of mental health, it really, the compassion and understanding help a lot because it gives them self-confidence. Somebody believe in me. Somebody doesn't think I am crazy. Myth number 8, it is impossible to prevent a mental health condition. Fact is, and a lot of research, while not all mental health condition can be prevented, early intervention and support can reduce the impact of the illness. Myth number 9, talking about mental health problem makes them feel even worse. Any of you believe in that? I grew up to think, don't say you are sick. Don't say you're depressed. Don't tell him that you are. I have 2 uncles that are doctors. Don't tell her she has fever. I'm burning, and I could overhear him with my mom. Don't tell her she has fever. To this day, I have to ask my husband or my children, feel me, do I have fever or not? Because I can't trust what I feel, okay? Mental illness, the same way people need to talk about it because talking about mental health crisis or suicide might put ideas in their head, but the truth of the matter is open and safety about issues regarding mental health, thoughts, feelings, and suicide help people feel they're being heard and understood, and somebody is there that they can rely on. And that's what I do day in and day out for the last 35 years. Mental health conditions are rare. Well, we saw from the statistic, it is not as rare as one think, but people hide it because if I were to tell you I am mentally ill, you're gonna avoid me and say, nice talking to you, bye-bye. I don't know how you're going to react next time. Last but not least, and that's not, complete research, but I just picked up what I thought it was common myths that we believe in. People who have mental illness result from personality weakness or character flaws. If they want, they can just snap out of it. I've had an anxiety and panic attack since Ramadan. Okay, I want to tell you that, okay? And the advice I got from a lot of people, hey, you're a therapist, just snap out of it. Everything is going to be okay. I know better than that. The fact is, common misconception about mental health condition is that overcoming them takes enough willpower, discipline, mental toughness. The truth of the matter is, it's like physical condition. Mental health condition cannot be just willed away. It is all the chemical and hormones balance that need to get back into basic in order for a person to feel a little bit better. Many factors can impact mental health. The type of treatment, the type of therapy you're going to be receiving. Recovery takes time, practice, healing take a long time to recover, just like physical illness. It is essential to examine these myths and understand that mental health is just as important as physical health. By breaking down these obstacles and misunderstanding, it will open up an honest conversation, releasing pent-in silence. Thus, we can create a more supportive, understanding environment for those who are in desperate need for it. Now, how am I doing on time? I'm okay? Okay, so I'm gonna demonstrate to you how the mind and the body and the brain interact with one another. There's a picture. The picture says better than 1,000 words. Do you see where the brain is? And do you see where all the neurons, all the nerves, all the cells that communicate between the brain and the body muscles, as well as nerves, all this communicate on every second of every time we are living, these communication going. Even when we are sleeping, there is a guard in our brain that does not sleep. That guard maintains that we don't fall out of bed, that we keep on breathing, that our nervous system, if we hear a noise, we are awakened because that guard is never sleep in our brain. So, okay, do you want to put it up for me? Okay, let's see if I can do that. I can't. How do you push it up? That's not my computer, by the way. It's Erica's computer. So, okay, beautiful. Thanks, love. Okay, so let's go to the next one. What does it mean to have a healthy brain? The U.S. Center for Diseases and Control and Prevention, CDC term, a healthy brain has the ability to perform all the mental process, such as cognition, including the ability to learn, to judge, to use language, and to remember. A healthy brain does all this. In addition to that, it's a command center. It commands the nervous system, and it enables us to think, to memorize, to do movement, and even the emotion by complete functioning between the body and the brain. The maintaining a healthy brain, it really is the uppermost goal in our life, because it means a healthy body, a healthy mind causes longevity as well. As the population ages, the burden on the research right now, it has challenged the neurologist to begin to do a lot more research to keep the mind in a healthy state. So a healthy state of mind, what does that mean? Why we need to do brain function? Because one, the brain generates internal signals that register what our body needs. So your body is thirsty, your body is tired, your body needs nourishment, relationship, I want to reach out and be your friend. The brain understands that. So what does it provide? It creates a map. So you walk down the stage, you go over to this young, beautiful lady, and you make a connection with her. That's the brain does its mapping. It also warns us of danger. Remember, with our brain, it preserves our survival. A healthy brain adjusts our action accordingly, and it coordinates and deliberates between the body and the brain by sending all these signals. That's how healthy brain function. So let's go next to defining body. How does it integrate over here? And I'll kind of go over it quickly. There are many different approaches. As I said, right now, the medical approach versus the integration of holistic, they are at odds with each other, at least about a decade or 2 decades ago. They find that the medical approach concentrated only treating the patient with the symptoms. They do not ask how you've been, what are the environment that you are living in, what's going on. So they just function, you got a headache, you got a stomach pain, okay, let's give you this pill, let's do this test, and it's only medical, okay? Now, the mind and body connection, not just a theory anymore in this decade, okay? The field of psychoneuroimmunology, that's a mouthful, has witnessed an explosion of empirical research and findings within the last 2 decades. We're only very, very new in our research. The body holds your physical health, your ability to function. For example, the little movement of my fingers right now, it gave a signal that I need to point out to this through the brain. Check it out. The brain has sent a signal, move your hand. Your hand is getting too tired, stretch a little bit, okay? So that's how we know. Today, the recent study demonstrated evidence that mental and physical health are related to each other. You cannot treat the body without making sure the environment, the ambience you're living in, the situation you're exposed to is very important. If your doctor doesn't ask you that, please ask him or her that I've been having a lot of stress. Okay, so in the field of psychology that I had from, I think, the first year of psychology, even before Sigmund Freud came about with the psychoanalysis, have argued why the body-mind concept are crucial to psychology. The reasoning for this stems from the idea physical condition affect mental, mental affect the body. Way before, we're talking about the early turn of the century. I would like you to think, for right now, bear with me, we are a small audience, so I'm going to demonstrate. So I would like you to think of one stressful situation that you encountered today, such as coming to the center. Will I face traffic? Will I find a parking spot? Will I find my way? Feel it in your body. Just close your eyes or keep your eyes open, it depends, and feel it. See where you're feeling it when you think of the stress of waking up early in the morning. This is Sunday, I'm supposed to be resting. So you have a little bit of stress. Where is your stress? Just recognize it, you don't need to tell me. See where you're feeling it and see how your body kind of got a little bit tighter, maybe, okay? You're pointing out to the chest, right area, perfect. Okay, now I get you out of that stressful place. Now think of a good event. I got to the center on time. I'm one of the very few that attended this lecture, and it's fabulous lecture. I'm just kidding. But I'm so glad I am here to receive this information. I am happy. Feel it. See where are you feeling it right now. See the difference. I actually tried it on my treadmill. I thought of a person that I did not like. She doesn't like me either. And I found my heartbeat went faster, okay? And I thought of somebody that I really care for, and Sister Erica, and my husband and my family. And all of a sudden, the heart calmed down. And my hand is not like, oh my gosh, you know. So please, this is demonstration. When I got to this stage, when I got to the center over here, I had butterfly in my stomach. You know, how many people are going to be there? Will there be enough audience? Will I be able to remember the talk? Will I be able to? And then I calmed down to say, I'm just going to give my information, and whoever received it, ahlan wa sahlan. So our thoughts and our emotion don't only exist in the mind, but they have connection to our physical feeling, as you just demonstrated. Okay, to summarize it, just in case I have not labored that point, in mind and body medicine, the mind and body are not seen separately, functioning entities, but as functioning unit. The mind and emotions as well are viewed as influencing the body, as the body in turn influence the emotion and the mind. All right, so what I just said, it means that there is up and down, up from the body saying, oh, I just burned my finger. The brain is going to send a lot of messages, get your finger away from that hot spot, right? That's how it works. But also the mind can see a gun pointed at you. Take cover, go under. The mind just send a message for survival, okay? So that's how it works, up, down, up, how the body interact with one another. Hello. What is it you're doing? Oh, just up here, okay. All right, so I wanted to talk, it is very important for us to talk about stress in our body. okay? The stress environment that we have experienced, it's very important for us to recognize what kind of stressful condition are we living in. And I think I have time to do that, right? The stress, okay. Because the idea, whoops, okay. So stress is natural occurrence in everyone's life. Stress is normal and inevitable even before birth. While you're carrying the baby, the stressed baby can sense it. Stress is necessary for a human being to cope with for survival. It helps us develop skills and tools how to adapt to new and challenging situations during our lifespan. This one is definition by the CDC. Studies demonstrated the psychophysiological based model where certain neurons and muscles coordinate to let you know that you are experiencing stress. The up, down, and down, up, the communication. What happened? You don't need to remember the neurotransmitters and the hormones, but I'm just going to mention it just in case it comes up for you. There's serotonin. There's epinephrine neuron. There's adrenaline. You know, I'm on high adrenaline. It comes for me, okay? Cortisol, if it is produced evenly in the body, it's the greatest hormone we have. But if it is high, it disables functioning of the vital organ in our body. So we need to live in a balanced sort of life. And that's how the body communicates through all those hormones and all those neurotransmitters. Research has documented mechanism through which stressful emotion, while the blood cell, you know, the white blood cells in our body act as defense weapon against all infection, while the stress does tend to destroy some of the white cells. So when we have problem with viral infection, with any of even cancer cell infection, our white cells supposed to be healthy enough to counteract it. But if we are under stress, the white cells no longer vital, no longer, what do you call it? It's a negative impact on our health because we don't have enough weapon to be able to do that. Okay, so let's talk about, and I'm going to show you a couple of pictures and then I'll move on. So in 2013, as early as 2013, a research was done to map the emotions of people, okay? Where do you feel the emotion? Just like I had you try it when you were stressed, when you were happy. Where do you experience the emotions? Okay, so they said the sensation send from the mind to the body, body to the mind. Mainly we hold, and the young lady here, she held her chest and she said, right here. Well, that's number one, where we feel the emotions. If it is a sensation, any sensation that is, not necessarily the happiness or anger or fear or whatever, but we experience it in the chest, we experience it in the head, we experience in the facial. You recognize, you know, people said, are you angry? Are you hurt? Are you upset? Because the face does express these things. And in the digestive system. The picture below represents a map of the body as of 2013. It said the yellow indicate the highest activities in the body. I'm talking about activities, not stress, just activities where the body begin to feel. Then red, then black, and then blue. That is the least of the activity. Let me go to the picture and you will see this one. Can you see where? Okay, this was gonna turn me on side right, wrong side up. Okay, so in the anger, do you see where the body experience? In the chest, the yellow right in the chest, right here, when we feel angry, and then the red and you see the yellow in the arms because we need to defend ourselves when we're angry. When we fear, the red, do you see, and yellow near the digestive system. The body send all the blood inside to the digestive system to protect it. So there's a lot of activities in there. And the red all over the upper side of the body, even to the intestine. Disgust is the same, similar. Happiness, look how happiness is. Throughout your body, you feel the activity, the sensation when you're happy. You're jumping up and down and you're feeling good. So your whole body sensation activate. Sadness, you will see the black. There's hardly any sensation in the body except the chest. Again, the surprise is like somebody surprised you. There's activities in the chest and in the head. Okay. Last but not least, anxiety. You even feel it in the reproductive organs all the way to the side of your head. Love, I like that one. Do you look at the legs? You will see there is red in there. So there is activities even when you're feeling you're in love and you're seeing your loved one coming. Your whole body, right down to your feet, they're experiencing high sensation. Look at the yellow in there. Now, depression, people say depression is sadness. The truth of the matter is, and I'm here to share this with you, when you're depressed, you are totally shut down. There is no sensation in your body. You're on automatic gear. You know, nothing is, you know, I need to eat, I'll eat, but I don't feel anything. I'll drive, but I don't see anything. So that's what depression means. Pride is the same thing. Beautiful. You feel it. And I'm sure the people who graduated with their parents, I'm sure they're feeling that yellow sensation in their face and their body and so on. All right. So we'll skip to the, oops. Okay, not here. Hello. I'm sorry. There we go. Okay. So the positive, so we already talked about that. So we'll go to all the way down. We're almost finished. Body and mind integration. Now you connected the process of the brain, the process of the body, the up, the down, and the down up. And right now, what should we do about it? You know, I presented all those good stuff. The first and most important, please, if you don't remember anything, be mindful. Be mindful of your body. What are you thinking? What are you feeling? What are you experiencing at the moment? You know, this sense of awareness really and truly helps the body to reduce the stress. If I know I'm stressed, I'm not going to go and drive a long distance, or I'm not going to go get up and cook 3-4 meals. I'm going to say, you know what, my body is telling me I'm exhausted. I'm just going to lay down for 10-15 minutes. Or I'm really stressed. Somebody just called me and gave me bad news. I'm going to go for a 5-minute walk. Give yourself, love yourself. If not, be kind to yourself. That's really important. So the journey to healing. Okay, we have 2 studies that they did on Palestinian adults, young adults and children. They demonstrated to us, there was 129 Palestinian young people in that study. These mind-body treatment and intervention, they used meditation. And you know, when you do your salah, it's meditation, people. You're talking to God, God talking to you, back to you. Breathing techniques, learn how to do breathing techniques. Autogenic training, biofeedback, it's still in existence, and it really does help a lot to introduce you to where your body's sensation is. Genogram, it really helped to look at your family background to see if anybody has had anxiety, depression, any type of mental illness. Check it out because it does help you to understand. self-expression through drawing and movement. And I use that a lot with children during 9/11. After 7 months of this, there were improvement. And we're talking about stressful Palestinian children and young adults. They showed a great deal of overcame the sense of hopelessness and helplessness. And there is nothing worse than feeling there is no future, there is nothing left for us. Remember that understanding and destigmatizing mental health is crucial. If you or someone you know needs support, please consider reaching out to mental health professionals and organizations that can provide guidance and assistance. The literature documents the efficacy and the importance of talking therapy. Talking therapy really does help, and I'm attest to that. I still go to my own therapist because after seeing so many patients for so many years, I do internalize it, and sometimes I take it on. So I have my own therapist, and it helps me overcome and externalize what I need to talk about. And Tom, my husband, as well, help a lot. I think by now he knows he's my second therapist. Thank you. That comes to you. Okay, so one other two, how am I doing time-wise?
We have
5 more minutes, very quickly. Once again, if your body said, I don't want to accept any invitation, I don't want to go to the party, I don't want to go shopping, do it anyways, okay? Do it anyway. Why? Because the more you reward the stagnation of COVID, the worse it gets, okay? But if you are not able to physically, please pay attention to it. So the most important things that I can advise you, there's a lot more, but I eliminated because of the time concept over here. Become aware of what you're thinking and you're feeling. Acknowledge it. It's okay for me to be sad. There is a lot of sadness. There's a lot of stress around us. There is all kind of events that causes me to feel really sad about it, and I feel hopeless until I move into action. When I put it into action, volunteering, accepting, giving talks, and I give talk almost every other week, and it helps me that I am doing something that is something, it helps me to move to action rather than feel the helplessness inside. So I want to thank you for those of you who attended. I appreciate it. And inshallah, did we put, Erica, did we put these are community support system. It's really wonderful. It's great that our center providing this. I know that Sister Erica said this is a live stream. It'll be recorded. YouTube people, Facebook people may be watching. So I hope if I made a little bit of difference in understanding mental health, I'm very appreciative and grateful. So thank you all for coming. Appreciate it.
Does anyone have any questions? Okay.
Oh, I'm sorry, I didn't read the dua. Can I read the dua, please? I'll just take 1 second. بسم الله الرحمن الرحيم ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين. And most certainly shall we try you by means of danger and hunger and loss of worldly goods, of lives and of labor's fruits. But give good tidings unto those who are patient and an adversary. And the next one, very quickly, sorry, Erica, I'm giving you exercise. And this is the most that really touches me. وَإِذَا سَأَلَكَ عِبَادِي عَنِّي فَإِنِّي قَرِيبٌ أُجِيبُ دَعْوَةَ الدَّاعِ إِذَا دَعَانِي فَلْيَسْتَجِيبُوا لِي وَلْيُؤْمِنُوا بِي لَعَلَّهُمْ يَرْشُدُونَ. And if my servants ask thee about me, behold, I am near. I respond to the call of him who calls. Whenever he calls unto me, let them then respond unto me and believe in me so that they might follow the right way. Thank you. Thank you. Thank you. Thank you so much. Sorry, I'm gonna read this down. And the young lady has a
Did you have a
question.
question? Yeah.
I have a son, he's 27 years old, and he was diagnosed with ADHD, with autistic when he was a kid. And he used to give him those pills. remember?
Yeah.
You know,
I don't know.
and one time I came to pick him up from school, he was here. He said, he doesn't want me to talk. I want to, we were
Use the microphone. I'm sorry.
we were divorced and I asked his mom, ex, tell her what's going on, why are you giving the pills? Well, he needed, the doctor said so. When I went to the doctor, I asked him, he said, well, this pills, if he's taking it now, when you go away, when you use drugs, you need to do a lot of things. Right? And anyway, now he's 27 years old. He doesn't do anything. He's only music. And I haven't seen him for 2 years. He just come back. Or 2 weeks ago, 3 weeks ago, I saw him. I talked to him. He was like, on the music. I'm tired. I want to go back. And he's not saying, I don't know what they're gonna do. He need only money. Help him. Yes, he doesn't want to find a job. Doesn't want to even go to a license. He doesn't want to even renew his eyes. I don't know what they're gonna do. I said,
Yeah.
now we don't talk to him anymore.
Uh-huh.
I
see.
He was staying with a friend and his friends kicked him out. Now his mom called me
Yeah.
and she find a place for him with some friend. I don't know what they're gonna do. I ignore him or I gonna be close to him. I don't know what they're supposed to do.
My suggestion, I don't know who told you to stop the drugs because, there are drugs and right now a new generation of drugs is, it comes and it's very effective for adult ADHD and there is a great deal of improvement. I have many people with ADHD and it helps them. And also there is a NAMI. Sister Erica will give you that number, the 800 number. Give them a call. They give a beautiful support to parents who have children mentally ill that will be very helpful. They give them the support. They give them the resources. They tell them which doctor would be a good idea to go to, but do not ignore him. He needs your love and your support. Do you need to give money to him all the time? No, you say within limits. I like you to, after you talk to the NAMI, which is National Alliance for Mental Health, I use them a lot and I refer my people to them. And it will be very helpful. And Erica will be able to give you that number, of
Yeah.
course.
Thank you so much, Dr. Ilham Al-Sarraf-Rope, for this beautiful and enlightening and heartfelt presentation. And please join us now in the prayer hall for Doha prayer, inshallah. Thank you. Assalamu alaikum.
Thank you so much.
Thank you.
Do you have the phone number? The other-
Yes, it's right here.
It's right here.
If you want to take a picture of it, that's
Yeah,
the
okay.
easiest.
Great, she's very good.
Yeah.
Mashallah.
Mashallah.
Not too bad. Nobody